All right. Thanks for coming out to pitch day for 100K. It's always a great day to pitch, but I really like our fortnightly process that we have here. Today we're going to hear from Cad from Truss Health. She's right here in the room. And Nikhil from Ellie Health is going to pitch to us from online, somewhere out there in the world. And congratulations to both of our founders for getting here today. We usually have 15 or 20 companies that are after each one of these spots here on pitch day. And we do put you through a bit to get here. So thanks for going through that bit and getting here. StartUpNV is Nevada's statewide nonprofit startup accelerator and incubator. We operate 7 free programs for entrepreneurs or founders, if you prefer, and 4 for-profit investment funds to make investment in these companies. Government grants and corporate sponsors support our nonprofit mission. They support it in the short term, and then over the long term, we're supported by the accelerator companies who donate a small amount of their equity to the nonprofit, and to investors in our funds who donate some of their profits to the nonprofit as well. Now, we run Pitch Day for 100K fortnightly on Wednesdays, where companies pitch for the Q&A and to get into our accelerator program, which comes with an investment from FundNV. Now, that investment from FundNV is added to by our investor syndicate. All of that money is put together and it's matched by the state's SSBCI program. So since 2021, our funds and syndicate have completed 30 transactions in 20 companies, directly investing a little over $9.4 million. Partners like GoEd with their SSBCI program and other venture firms and angels invest alongside us. That makes that $9.4 million into a total of just over $30 million since the time we started investing in 2021. That's an average, if you're counting, of about $500,000 per company, $500,000 per company direct, or $1.5 million if you include all of our partner investments in those companies as well. Now, our $9.4 million worth of direct investments to date are currently worth $27.3 million. It's a pretty good track record for a group that's been investing for just 3 years. So thanks again to our founders who are pitching today and to our investors who join us in our funds and in our syndicate. Now for the legal disclaimer, so everybody perk up for this part. The founders who are pitching today are pitching for investment from our venture funds and our venture syndicate, which comply with the SEC and Nevada Certified Investor Regulations. Now, we invite the whole community to come out and attend for educational purposes, kind of like tuning into Shark Tank. That helps our whole community come up to speed on how all of this works. It's part of our mission. So once again, the pitches today are not general solicitations from the general public for investment. Now, our nonprofit work would not be possible without financial help from our grants and sponsors, the City of Las Vegas, Clark County, the Governor's Office of Economic Development, the EDA, and the USDA are our primary supporters from grants perspectives. Thank you very much to those organizations for their support. So up next is Cad. She's coming up to the front of the room. So I'm going to step out of the way and give her the stage to share her screen. I'm going to scoot right behind you. Oh, we need to give microphone.
Thank you so much. Bear with me, please. Do I get started?
Yes, we can see you and hear you.
Okay, thank you so much, everybody, for the opportunity. My name is Cad, and I'm CEO of Truss Health. Now, Truss Health is a patient monitoring platform to assess patients' wound site, and what we do is early detect surgical site infection. Now, antibiotic-resistant issue, the deaths associated with antibiotic issue is going to surpass cancer deaths by 2050. And during this time, it's going to cost us $100 trillion and 10 million deaths. Now, what is antibiotic-resistant issue? There are superbugs which cause infection. Now, surgical site infection caused by MRSA, which is one of the superbugs. Now, when a patient is discharged from the hospital, 70% of the surgical site infection are detected at home. And why is that? Because we are discharged fairly quickly. Now, when we are discharged at home, there are 2 ways which patients communicate with their doctor. One is basically they send them random pictures, or second is they wait for their appointment, the post-surgical appointment. Now, when they're at home, when they send pictures, over 50% of the images which are sent are useless. They are not diagnosable. On top of that, people with my skin tone and darker skin tone do not show redness or erythema. And that's because that causes delay in diagnosis. Because of that, there is no platform which helps with early detection of infection, and patients with my skin tone do not get equity and do not get early diagnosis. This is where Truss Health comes in. Now, Truss Health is a kit, hardware kit, which we give to patients in pre-surgery, and our app handholds the patient through the journey. We are against a fight related to antimicrobial resistance. And to take that bold approach, we are using a sensor fusion monitoring platform, because of a physiological situation, which is as complex as infection, needs multi-sensor. To do that, what we have done, we've got military-grade technology into our platform, which is thermal camera. Thermal camera, along with digital camera, helps us assess the heat patterns of the wound site. That, combined with Google Fitbit, which we have partnered with, gives the physiological markers. And we have our own proprietary sensor, biochemistry sensor, which assesses the pathogens on the wound site and not only says yes or no, but also the detection limits. Now, when a patient is diabetic, which is a huge population in India and as well as you, 1 in 5 are diabetic. What happens? The immunocompromised, which is why we need multi-sensor, because your symptom to infection and my symptom to infection is going to be completely different. And that's where power of AI comes in. When we get multi-source of sensor technology in, AI helps us with detecting accurate assessment. We have partnered with 2 clinics in India already, whereby we got 150 patient data, and we filed 4 patents on it already. What we have assessed is our technology is able to assess 6 days of before the visible signs of infections come out, which is so valuable, because when I spoke to a wound care doctor, they immediately tell me this is fairly valuable because we don't want infection brewing inside the skin and getting worse. We would call the patient in sooner, cut open the wound, and get the drain out. Now, I'm going to go through our MVP very, very quickly. This is our wound portion. We have 2 MVP. One is related to the wound, open wounds, and one is related to a total knee surgery, because we belong to acute and chronic market. The patient goes through the journey of assessing the thermal and digital, and our LLM, when they get the pain data, they are able to figure out the organic part of the portion and the closed part and assess the whole wound and give recommendation on what steps the patient should be taking. And the dashboard assesses to figure out how the wound is getting measured, so that basically they know what the journey of the patient is like. This is a total knee replacement surgery. As we can see, when there's total knee replacement done on a patient, there are multiple ways in which a patient is assessed. Range of motion. How is my range of motion? How is my redness? There are a lot of parameters. So our platform assesses patients with taking them through the exercises, the dashboard, the physiological marker, and the range of motion as well. Eventually, it will give you the result dashboard, which is not only associated to the wound, but the overall well-being of the patient, which includes nutrition and stress management. Okay. Now, the market size of wound care is very big, just because, like Dr. Nick said, it is a chronic conditions, basic, and people are living longer, and obesity, diabetes causes the wound to stay for a very long time. What we aim to do is get into clinical applications with 2 main criteria. How does it impact a patient's life when we do early detection of surgical site infection? And second is, what is the rate of infection? Now, knee infection, almost 5% of knee surgery patients land up in an infection. When we talk about spine surgery, I had a spine doctor tell me, because of spine, you cannot see this perspiration. He himself got infected. Spine surgery is 15%. And when we start talking about abdominal, that's 25% chances of infection. So that's why the digital wound care market is fairly large, and 2/3 are outside United States and 1/3 of it's in the United States alone. Now, do we have competitors? Yes, we do have competition, but they are on the fringes of what we do. Bioformis looks at patients' recovery just using the tracker alone. Aranz and Swift Medical look at digital pictures, and we've spoken about the shortcomings of that. Ruby Tection as an invasive device to assess pressure ulcer only, and Moleculite looks at open wound. We are the only platform which looks at acute and chronic care and is comprehensive. Now, what is a business model? There is a direct CPT code, which is necessary for patients to, for doctors to build the insurance system. And that CPT code exists for post-surgical patients, and we get paid for, let's say, knee surgery. Patients are monitored for 2 months. We get $313 reimbursed already. A go-to-market strategy is basically what we want to do is this year is create our MVP. We've been efficient in our fund. We've already created our MVP, create orthopedic partnership and research collaboration with our hospital systems, which is going to help us with our channel partnership. Eventually, we want to expand geographically and clinically, and by a 5th year, exit with $100 million revenue. Now, who's the founding team? I'm the CEO of the company. I have 5 years of experience in Stanford Children's. I manage the entire digital health technology through COVID. We won twice in a row eHealthcare awards because of a patient engagement solution. Before that, I worked for Kaiser Permanente, and I have got my MBA from Wharton UPenn fairly recently. Our Chief Medical Officer is Dr. Dang. He is Chief Orthopedic Surgeon of Veterans Association Hospital in San Francisco, which is one of the leading ones. Sully Lavasti, he's our CTO, and he is a pioneer in early detection of disk drive failures because he worked in storage. Now, what is our ask? Our ask is $1.5 million with a convertible note. Our valuation cap is $8 million with discount rate of 20%. How we plan to use the funds? Primarily research collaborations with the hospital and start getting more data. Second is to continue to create our MVP and continue to have partnerships and marketing and sales, and also create a hardware prototype. In fact, I'm happy to say that our first version of hardware prototype is made right here in Las Vegas. Now, what have we done in this past year? We have got partnership and investment from a 3D printing implant company called Zeta, which is based out of Nevada as well. They not only give us FDA knowledge because they have 52 FDA approved devices, but they give us access to their hospital customer, and they've invested in us because they heard from their customers that the moment implant exists, there is an implant, there is chances of surgical site infection. We've been chosen as a startup program by Google, Intel, and I'm very excited to say we've been chosen as top 15 startup by Plug and Play MedTech division last week. And we've also been in part of Ignite Healthcare. One of the research partnerships we have done is 2 in India. We have an application at SFVA, and KIMS is the largest corporate hospital in India. The chief of surgeon told me that everybody's doing AI in respiratory diabetes. Nobody's looking at infection, which is a massive problem waiting to happen. And we are going to start a customer pilot with advanced wound care very quickly. That is pretty much it. Thank you so much, everybody, for listening.
Thank you.
Thank you so much. I really appreciate everybody's time.
Thanks for coming. Don't forget to stop sharing, but yay.
Thank you.
And welcome to here. We're so glad you are here.
Yeah, this is home now.
Building all sorts of awesome stuff. Oh, yeah.
Oh.
Great.
That's
Thanks
fine,
so much.
right? Thank you.
Thanks so much. I know when one of the startups that I worked on several years back was a computer vision thing where one of the use cases we looked at was wound care. And we had trouble getting people to take pictures of themselves because of privacy. And it was like, well, you're not taking a picture of your face, you're taking a picture of your arm or your knee or whatever. And they said, well, we have tattoos. And that they identify me uniquely. And it was a really unexpected objection that we hit. Now, that product ended up being used for insurance claims for property damage instead of wound care, but that was a really unexpected thing. And I hope you don't run into the same problem. Yeah. Right. So, I mean, they were worried about their pictures of them getting out there in the world, you know, in compromising scenarios, you know, because they're mostly or partly undressed, and just so you can get a good picture of the room. Yeah. 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 So I know it's all HIPAA compliant and the rest. Heck, it's hard enough to get your medical records from your own doctor yourself, let alone other people trying to get them. But anyway, two fascinating presentations today. And thanks to all of our participants and our viewers out there, that whether you're watching live right now, whether you're going to be watching this back on YouTube later, thanks for tuning in today. And just a few program notes as we wrap up. Investors, if you're curious about how to get involved in that, turning $9.4 million into $27 million, also reach out to us on StartUpNV.org, or just follow the investor path instead, and fill out a couple of forms, and one of us will get back to you and tell you how it all works. And thanks again to the founders who pitched today. Thanks so much. Very, very interesting. And everybody who listened in and asked questions. And to our investor group who's going to be watching this later, it's going to be a tough one to go through. So we'll see you back here again in 2 weeks, and with 2 more awesome Nevada founders and companies. And until then, take care of yourself, and if you can, someone else too. See you in 2 weeks.